Hello sir, my name is Cindy. I'm a physical therapist for today. May I ask for your name and your birthday for verification, please? Okay, so for today's session, sir, we'll be performing specific assessments for your thoracodorsal nerve injury. So before I do this, sir, I would have to touch certain parts of your body and you would have to remove your shirt for certain assessments. Would that be okay with you? Okay, so I'd like to ask, sir, how you sustained this injury. Okay, so the thoracodorsal nerve injury affects the brachial plexus, specifically on the C6 to C8 cord. So this is usually associated with posterior cord injury. First, sir, we're going to do the inspection part, sir. So we'd have to ask you to remove your shirt, sir, so that we can observe your back. Would that be okay? Okay. Turn around, sir. Remove your shirt. Okay. So the reason why I'm going to observe your back, sir, is because the latissimus dorsi muscle contributes to the downward motion of your shoulder blade and also the inward motion also towards your spine. So if ever there's a weakness on this muscle, sir, it would mean that walay nagpugong, sir, so it would go to the opposite direction. It would go away from your spine and going upwards. So now I'll be inspecting your shoulder blade, sir. Kindly sit straight, sir. Okay. Also, I'll be checking the height of your pelvis, sir, to see if there's any deviation, since the latissimus dorsi muscle also contributes to the posture and also the level of your hips. So as I'm inspecting, sir, there is no problem. So if there's a major injury to the thoracodorsal nerve, there may be a deviation to the posture. So thank you so much, sir. Kindly put on your shirt now. So for the next assessment, we'll be performing the manual muscle testing and range of motion assessment. So for the manual muscle testing, sir, it will help me see if your muscles are strong enough in performing the action, while range of motion assessment helps me know as to how much your joints are able to move within that certain motion. Okay? So I'll be using this goniometer, sir, to measure as to how much the degrees your joints are able to perform. Okay, so kindly lie down on your belly, sir. Okay, lie down, sir. Okay, are you comfortable, sir? Okay, very good. So, for the first action, sir, I want you to lift your arm away from the bed like this, okay? And then, sir, then I'll be measuring it from your shoulder. So, on the count of 3, sir, kayo mo lift yung arm as high as you can, and then hold for a few seconds so that I can measure it. So, on the count of 3, sir, 1, 2, 3. Hold. Okay, very good. Again, sir. 1, 2, 3. Hold. Very good. Again, 1, 2, 3, hold. Very good. So now I got your range of motion. It is within normal range. So shoulder extension is usually from 0 to 60 degrees. So if it's less than 60 degrees, that would mean there is a limitation of your shoulder extension. So now we're done with the range of motion assessment. We're going to do the manual muscle testing of your shoulder extension. Okay. So I'm going to apply resistance here, okay? So on the count of 3, kindly lift your arm as high as you can. And then I'm going to resist you, okay? Don't let me push you down, okay? 1, 2, 3. Okay, very good. 1, 2, 3. Very good. And then last, 1, 2, 3. Very good. So now, sir, kindly lie on your back na, sir, so that we can test your range of motion for your medial rotators, okay? So kindly bend your elbow like this, sir, so that I can measure it from your elbow. So the motion we're going to do, sir, is we're going to bring your arm forwards like this, sir. Okay? So, ano lang, sir, ha? Bring your arm forward like this. Very good. So, I want you to do it as far as you can and try to hold it for a few seconds so that I can measure it, sir. Okay? On the count of 3. 1, 2, 3. Very good. Yes, sir. 1, 2, 3. Very good. Last, sir. 1, 2, 3. Very good. So, for the normal range of motion for your medial rotation, it is usually from 0 to 70 degrees. So, if there's any limitations to that, it would mean your results would be less than 70 degrees, okay? Okay, sir, so now let's start off with our passive range of motion exercises. So, this will help your joints maintain its integrity, so meaning dili siya mag-stiff as we go along through our plan of care, okay? So, let's start na, sir. I'm going to touch certain parts of your body. Is that okay? Let's start na. So now, sir, we'll be performing a neuromuscular electrical stimulation, which is to help you educate your muscles by facilitating muscle contraction. So, assuming that your sensation and skin integrity is all intact, I'm going to place these two electrodes which will produce a current. So, you'll be feeling a tingling sensation. So, tell me, sir, if you feel any sensations other than that, okay? So, let's start, sir. Kindly lie down on your belly so that I can place it on your muscle. Okay, are you comfortable, sir? Okay, so I'll be placing these two electrodes on your back. So the action I want you to do, sir, is I want you to lift your hand away from the bed. Okay, like this, sir. Okay, Kyra. So I want you to do it as far as you can while ma-feeling mo yung contraction. So feeling mo sa contraction okay mo, start na ka og lift mo ang hands mo away from the bed, okay? Okay ra? So, assuming, sir, nga ni contract na, sir, kindly lift, sir. Okay, very good. So, mag-start na to, sir, okay? Okay, we'll be doing this for 15 minutes, okay, sir? So now let's do lat pull downs with the resistance band. So first, sir, kindly grab the resistance band and position yourself with your arms and back straight with your core tight. Okay, very good. So now pull the resistance band downwards with your back straight and making sure you squeeze your shoulder blades. Okay, very good. So when you return back to normal position, try to control the tension of the resistance band. Okay. Good. So now, sir, we'll be doing this for 2 sets of 3 reps or as long as kaya nimo, sir. Okay? So first, do sa tag 3 reps, sir, and tell me, sir, if kaya pa nimo for 5 reps. Okay, let's start. So now let's do seated rows with a resistance band. So first, position yourself seated on the floor with your legs and back straight. Okay, very good, sir. So now grab your resistance band, sir. Okay, and wrap it around your feet to make sure they're secure. Okay, very good. So now grab the resistance band. Okay, with your arms straight like that. Okay, very good. So now, sir, kindly bring the resistance band towards you, making sure you squeeze your shoulder blades. Okay, very good. Ana lang, sir, ha? Again, to return to normal position, sir, control the tension of the resistance band. Okay, very good. Slowly lang, sir. Okay. So, we're going to do this, sir, for 2 sets of 3 to 5 reps or kung kaya pa nimo to do more. Okay? So, let's start na, sir. So, now let's do dumbbell rows. So, kindly position yourself, sir, with 1 foot forward for stability, 1 hand on a stable surface, and 1 hand on your dumbbell. Okay, so with your back neutral, kindly bend forward, sir, so that the dumbbell is parallel to the ground. To start the exercise, bring your shoulders in by squeezing first your shoulder blades and then bringing your elbow backwards. Okay, so sir will be doing this for 2 sets of 3 to 5 reps or as long as kaya nimo. Okay, try not to fatigue yourself or para dili ta mas strain atong muscles.